Hello friends, our today's topic is adenomyosis. So what is adenomyosis? We get a lot of patients who come with a history of scan being done and which says that the uterus is bulky and with other problems in the uterus, and the lady has excessive pain during periods, excessive bleeding during periods, and sometimes they also have a history of infertility, or additionally sometimes on the scan they also have endometriosis. So what basically is adenomyosis and how is adenomyosis different from fibroid uterus? So fibroid uterus, there is a mass, a ball-like mass which is present in the uterus, and a small muscle cell of the uterus has developed a round structure like a ball in the uterus. And once it can be easily removed, but adenomyosis is not like that. So what is adenomyosis? Adenomyosis is different from fibroid uterus, and it's not a small thing, it's a big mass sometimes. And the endometrium of the uterus, so there are three layers of the uterus. One is the endometrium, the second is the myometrium, and then is the serosa. So the endometrium of the uterus is something that bleeds. So the endometrium sheds every month. But if the endometrium goes into the muscle mass of the uterus, it bleeds there and forms a mass. So adenomyosis is usually an enlargement of the uterus, and in general the whole uterus is enlarged and the endometrium goes into the myometrium. Now how the endometrium has gone into the myometrium is a matter which needs to be found out. Some of the patients are multiparous, they've had multiple childbirth, then it can go, or they've had histories of DNCs, then it can go. They have a history of endometriosis, or sometimes they have a history of multiple cesarean sections done. So the endometrium has gone into the myometrium either by surgery or by advancing age. So sometimes these ladies are in their 40s or in the 50s and they have delayed their childbearing and children did not come early, so the lady develops adenomyosis. So the endometrium of the uterus goes into the muscle mass and it bleeds there, and because the space is less during periods, there's a lot of pain. So it can be focal, like for example a mass has developed which is not like a fibroid, it's a random mass but it looks like a fibroid. But once we do surgical intervention, we come to know that it's not a fibroid but it's an adenomyoma. So adenomyosis is different from fibroid in terms that it's actually the uterus that has enlarged, and once we remove it, we remove a part of the uterus also. So the surgery is also technically more difficult and complicated. So in adenomyosis, what are the signs and symptoms? First, we will talk of the signs and symptoms. The lady will have excessive bleeding. She will have pain during periods. She can even have pain during intercourse. Then the abdomen feels very heavy sometimes, and they might have infertility also. So on scan, we see general enlargement of the uterus, and the anterior wall of the uterus is usually not affected. It is more affects the posterior wall of the uterus, and the posterior wall of the uterus is sometimes 3 times the anterior wall of the uterus. So these patients are usually infertile and it's very difficult to manage them. So how do we treat these kind of patients? So first is symptomatic management, but any medical treatment done on these patients, if the lady has completed her family and she's done with her childbearing, the uterus can be removed. But if they still are in need of a child or they're keen on fertility, then we cannot remove the uterus. So we cannot even give them medicines, because if we give them medicines, they will become infertile with the medicines, because most of the medicines that are used for these kind of patients, they don't let the patient get pregnant. So whether the surgical intervention is done or not is the call of the doctor who treats, because they will see this patient and then accordingly decide whether surgery needs to be done or not. So surgery is mostly done in focal adenomyoma, like a rounded mass is seen. The surgery is technically difficult because a part of the uterus will be removed and a balance has to be maintained between what needs to be removed and what needs to be left. And then sometimes the patient is not keen on surgery, even the doctor is not keen on surgery sometimes. Then some medicines are given, like for example, some injections which suppress the disease, like the disease is suppressed for some time, periods are stopped for some time temporarily, and then later on procedures are done. So however, patients of adenomyosis are counseled well. They have to understand that all sort of problems will come a little more to them. They have a lower chance of getting pregnant with IVF. They have a higher chance of having miscarriages, and there's a higher chance of having obstetric complications like problems during childbirth, low-lying placenta, and all sorts of problems. The reason is why obstetric complications are more is because the mass of the uterus is affected, and as the uterus enlarges, there is a resistance offered by these masses to let the uterus enlarge up to the optimum size. So it's not free flowing, like everything happens uneventfully. However, these patients need a lot of perseverance. Even their treating doctor needs a lot of perseverance. And finally, after maybe 2 to 3 attempts, if things don't work, we sometimes give up on these patients that, their chances of getting pregnant are too low and it's not going to happen. And we give up on these patients. However, it's worth a try. So all patients of adenomyosis need to go to a dedicated and a passionate fertility consultant who takes them up and then guides them accordingly, does not tell them unrealistic things that it's going to happen 100% and there's no problem. So patient has to understand their disease, and even their doctor has to understand their disease, and then they can be taken forward. So in order to recapitulate, adenomyosis is a disease of the myometrium where the endometrium has gone into the myometrium and it bleeds there and causes mass lesions and inflammation. And then the signs and symptoms are pain and dysmenorrhea during periods. And if infertility is the case, then they can be given either surgical options, or these adenomyomas can be suppressed with the help of medicines or injections, and then these patients can be taken up for IVF treatment. However, if there are any questions, you can comment in the comment box. We'll be happy to reply it.